Welcome to the 8th episode of Arogyam Kata. Today, we will be discussing adult immunization, and we have with us Dr. Sanjay Pattiwar. Dr. Pattiwar retired as Additional Commissioner from Navi Mumbai Municipal Corporation. He has more than 30 years of experience in public health and is probably the best person to talk about adult immunization. Dr. Pattiwar pursued his MD in Preventive and Social Medicine and also completed his post-graduation in management from TSS. His strengths lie in hospital administration and management, and he is currently working at Masina Hospital, Mumbai. Please welcome Dr. Sanjay Pattiwar.
Welcome to 8th edition of Arogyam Katta. Today we will be discussing about adult immunization. I used to think that immunization is only for the children. Till the COVID told us, or it was necessary during COVID time, that even adults have to take vaccines and they need to be immunized. And there were not only one dose, there were multiple booster doses and all that. Now, is it only restricted this adult vaccine? Is it restricted to only COVID or there are many other vaccines available?
Yeah, thank you so much for calling me. Basically, the adult vaccination is not a regular phenomena, but the child vaccination is a regular phenomena. And I think in universe or in the state of country of India, there is an universal immunization program is there, which has started in the year 1978. That's why we are very much aware of the child immunization. Because we know the benefits of child immunization, it is on very much on large scale. I can tell you that around 3 crores of children per year are vaccinated or immunized. Second thing is that the immunization starts from the day of birth, that is the polio, BCG, whatever the immunizations are. And we have to go for the boosters. So per year. So it is going from zero, that from the day of 1 up to 3 years. So in any given year, we are immunizing, child is immunizing for 10 crores of vaccinations we are doing. In this, we are adding also the pregnant women. The pregnant women are around 2 to 2.5 crores. So this is the chunk of the universal immunization program, or I can tell you that this is the child immunization. But where we stand in adult vaccination or adult immunization? First thing, the people will ask, what is the difference between the vaccination and the immunization? Because these words are very synonymous. But the vaccination is the process of giving vaccine. That is the vaccination. And immunization is the impact of vaccination. So that is the difference between the vaccination and the immunization. What is happening? Basically, COVID has taught a lesson. But the adult vaccination is there from last 20-25 years. The history of vaccination or the vaccination goes back to the 18th century. But that was basically related to the child immunization. The first vaccine discovered in the 18th century, that is around 1750, that is smallpox. Then the world rabies had come. Rabies, you know, all the people. Only the rabies vaccination is, people know that after dog bite, we have to take vaccination. There is no age limit or something like that.
Correct.
So rabies is the first vaccination known in adult vaccination, but it has not been designated as adult vaccination. Basically, what is happening in the society? There is no knowledge about the adult vaccinations. What are the schedule of adult vaccination? Whether we get in government hospitals, whether we get in private hospitals, then what are the importance of vaccination? I can tell you that adult immunization is also beneficial as far as the child immunization is concerned. We know that the child immunization has prevented around 2 to 3 millions of deaths, and that is the impact of the child immunization. On the similar line, the adult vaccination is also very important, because we know that now there are a lot of non-communicable diseases are happening. There are not a lot of immune compromised people are there, alcoholism there, then drug addiction is there. All these factors, then the chronic kidney diseases are there. So all these factors in adults, they are reducing the power of fighting, that is the resistance power. So in such cases, we need the adult vaccination or adult immunization. Second, adult vaccination is needed in the healthcare professionals. You know, the healthcare professionals are more vulnerable to these type of diseases because they are working in the hospital premises. COVID has taught a lesson that we should use the mask, we should protect from ourselves, and when we have some disease, we should also protect by getting the mask on face to other people. So what is happening? There is a need of health workers to get vaccinated, and government has started this. There are some vaccines which are now very popular. You know, the dog bite, the rabies vaccine is there. You know that when we want to go to the international travel, yellow fever vaccine is there. So there is these vaccines are given to the adult people, because basically COVID has taught. COVID has taught that adult vaccination is in entire world we can give it. There are no side effects of adult vaccinations. And we know the impact of adult vaccination as far as COVID is concerned. It has protected the countries in the world, and it has protected the India in unique case. So that is the basic adult vaccination or immunization.
Tell me, what is the vaccine? Actually, what does vaccine mean? We all talk about vaccine, immunization. What does vaccine mean?
Yeah.
What is it?
I think I will read this. This is a definition given by the World Health Organization. Vaccines are biological substances that stimulate the immune system to develop immunity against specific disease. They are composed of weakened or inactivated forms of pathogen or fragments of pathogen. Vaccine can contain synthetic component that mimic structure of a pathogen. So what is the vaccine?
So it's a small disease.
No. Vaccine is a artificial disease. We are creating disease artificially. There are two types of what I can say protections are there. That is natural immunization and the artificial immunization. Natural immunization is by disease. When we are in the society, we get suppose influenza. So it will give an protection for 1 year. But after 1 year, it doesn't give. So that is the disease which gives the protection. But these vaccines are the products. They are the live product. Some are the inactivated products.
Okay.
That means there are live viruses are there, but these live viruses are attenuated. Their toxic capacity is suppressed, and their antigen power has been increased. Once it is go in the body of the human being, they will not have any toxic impact, but they will boost the immunity. So that is the vaccination. And what this vaccination is doing, vaccination is preventing the vaccine preventable diseases.
Okay.
The people in the society might not be knowing about the vaccine preventable diseases. There are a lot of vaccine preventable diseases are there in the society. With the adult vaccination or adult immunization, we can prevent this vaccine preventable diseases. We can increase the productivity, and we can reduce the burden of the infection in the society. And finally, the herd immunity. That is, once the adult get the vaccine, he harbors that live attenuated viruses, and he spreads in the society. So indirectly, the people surrounding him are getting infected with these live attenuated viruses, and they also are getting immunity, and they are also protected.
So it's like indirect vaccination?
Yes, it is an indirect vaccination. But most of the times, what is happening? Indirect vaccination may not give 100%.
It's not
This thing.
It's not
it's better to give an scientific the doses of the vaccination.
Tell me, now even it's said that the diseases are changing or the new variants come in the market. Market means in the scenario. If I'm vaccinated, say for pneumonia, and a new variant of pneumonia comes in, am I still protected or my vaccine is useless?
Right, good question. Basically, virus is a entity, it get mutated. Every year it get mutated. The influenza or the pneumococcal, these type of vaccines or the flu, they are the seasonal variants. That is before the monsoon or before the winter season, where the immunity goes down of the population and they will get the infection. So every year the variants are different. They are the research laboratories or vaccine producing companies. They are keeping the track of virus mutants throughout the year.
Okay.
And it's an every year challenge. Every year we have to have a new flu vaccine with the modified variants. Some parts maybe 40-50% part of the virus will remain like previous year, but rest of the part is mutated, and that mutated part going to create a disease which cannot prevent the previous year's vaccine.
That's the reason why you have to take booster dose?
Yeah, that's why we have to take the booster dose and every year dose. The booster dose is a different entity.
Okay.
In some diseases, booster dose gives 5 years immunity, 10 years immunity, and the lifelong immunity.
Yeah.
But in influenza, it doesn't give the lifelong immunity because virus is getting mutated. That's why every year the new strains are coming. That's why we need a new vaccine. It may not be a totally entirely new, but it's a new vaccine, some modified vaccine to the next year.
Now, if there are bouquet of vaccines available and I need to take, now, actually, what are the most popular ones you would advise for an adult to take?
Right.
With, say, a person beyond 60 or what we call, of course, today nobody talks them old people, but say 60 plus. What all vaccines, what are available or what are recommended to be taken?
Yes. Basically, adult age is from the 18 years. So 18 to 27, 27 to 50, 50 to 60 and above 60. These are the categories, a normal category. There might be some difference between the age to age. But basically, the India has defined the senior citizens after 60 years of age.
Correct.
And as far as the public health is concerned or the medical field is concerned, above 60s, they are slightly vulnerable to some diseases because their immunity has gone down, or according to their age, their resistance power has gone down. So in India or in abroad, the most common vaccines recommended are the flu vaccines, influenza vaccines, and basically there are new vaccines are coming, but that they are not come in India. But the malaria, dengue vaccines have already been production has started with the approval of World Health Organization. So these are the vaccines where we can go above 60 years of age. 60 years of age. Basically, these are vaccines that one vaccine is still there. That is the herpes zoster, which is a neurological involvement of the particular person. So that is also very important because these vaccines, if we won't take these type of vaccines, the person above 60 years may get affected and his immunity will again go down and he may have a different type of diseases. So prevent that, to uphold his health or immunity or to protect him from the viruses, we need such type of vaccines after 60 years of age.
So if there is a bouquet of vaccines, is it because the pharma companies want to give that, or is it really from medically it is required? Because there's I feel it's a fear psychosis that you create a fear that this disease will kill you, and then you need to take vaccine. So the pharma companies make money. Is that the case, or is it because the government has no program for senior citizen vaccination?
Yes.
Like what you have for...
Yes, I agree for that, because till this point, the medical societies, different hospitals or health societies, they have their own schedule of adult vaccination. But now the government of India has come with a solution. They have formed a committee of all the stakeholders, including the super specialty doctors and from the entire India. Now they have given a suggestion to the government of India that we should include these type of adult vaccination in adult vaccine program, and we should have a schedule like a child immunization program.
Okay, correct.
So that has been now formulated. I think in this maybe in coming year, the adult vaccination schedule is going to come from the government of India. And it is not basically, we were talking same about the child vaccination, but child vaccination has given us a lot of benefits. It's not the pharma company or doctors or something. It is the need of our. Because considering the impact of vaccination and getting the benefit, I think it is not a compulsion, or it is not the pharma company's propaganda or anybody's propaganda, but it is the need of our. We should go ahead with the vaccination, and whatever is applicable to the child immunization, similar is applicable to the adult vaccination.
Probably the last question. A person with comorbidity, can he, or allergies, can he undergo vaccination?
Yeah, I think there are a lot of not lot of contraindications, but there are contraindications for the vaccination. If somebody has the allergy, that need to be tackled at individual level. If somebody is having cancer, HIV, AIDS, these people are immunocompromised. In this situation, we need to assess that particular individual, and after assessing, the individual doctor decides whether to go ahead with that. But as far as the on large scale is concerned, there are no side effects of these type of vaccination.
Okay.
Even if the side effects are there, they are very mild.
Minimum.
So it's like taking the fever will be there for maybe for 1 or 2 days, or the pain will be there. The entire body ache may be there for 1 or 2 days. The local pain will be there. So it has been proved that side effects are not to worry. And whenever we are screening the patients, the immunocompromised, cancer, HIV, pregnancy, adult or the senior citizens,
diabetic patients,
hypertension, alcoholism, all these are factors are considered while giving the benefits are waived. Whether the disease which is causing problems to that particular, and what the vaccination is going to do, whether the vaccine is going to get the benefit out of the disease. So that is the decision making point of individual doctor.
So if I summarize, that adult vaccination is required, but it is not a over-the-counter product, OTC product. You can't go to a chemist shop and buy a pneumonia vaccine and through a nurse inject it. It has to be administered, and it has to be under supervision of a medical professional. And if that is done, I think that's the way ahead. Am I right?
Yes, you are right. Anything across the pharmacy should not be done, because these are the safe vaccines, safe immunization things, but still it should be according to the advice of a medical doctor. And there are some chances of anaphylactic reaction, allergic reactions. So it has to be taken in the hospitals. If suppose there are immediate reactions are there and the delayed reactions are there, So we have to have these type of things, and I think the adult vaccination and immunization is coming up. Lot of corporate hospitals have gone beyond the government of India suggestions, and they have already started the adult vaccination. And the Masina hospitals is also starting the adult vaccination program. The people can come and ask us. They can tell about themselves, what is their age, what the vaccinations, previous history of vaccinations, what was the previous diseases they have. So the doctor who is in Masina Hospital will definitely advise them a schedule, and according to that schedule, that person or individual should go with that.
Thank you very much for coming to Arogyam Katta and giving us insight of adult vaccination. I know it's a very large topic, can't be discussed in 15 and 20 minutes, but in the given time, you have really answered it well. Hope the viewers get benefit of this discussion.
Thank you, Mr. Gadgil, for calling me for Arogyam Katta. This was really a good episode, and I look forward that you will call me for other also episodes. And this is really going to give a good knowledge to the common people. I again congratulate you and my best wishes to the Arogyam Katta.
Now, I'll be asking you a few rapid fire around questions where the answer would be yes or no, or very, very brief answer. Vaccines protect against diseases.
Yes.
Adults can get vaccinated.
Yes.
Vaccines may have side effects.
Yes.
Vaccine works against new variants.
No.
Getting multiple vaccines at once is safe.
Yes.
Following vaccination schedule is important for adults.
Yes.
Allergies can impact vaccine eligibility.
Moderately.
Vaccines play a role in preventive outbreaks.
Yes.
Live vaccines differ from inactivated ones.
Yes.
Reliable vaccine information is essential.
Yes.
Thank you.
Thank you
for answering all the questions.
If you liked the video, please subscribe to our YouTube channel, Arogyam Katta, where we bring you insightful interviews with doctors from various specialties. Stay tuned for expert advice and valuable health information.